Health Minister Edwina Currie caused a stir, right old to-do, after she appeared on the programme yesterday, because she said that if we're going to deal with obesity, people simply have to eat less. She said people know what to do, they just need to get on and do it. We can't muck about.
Stern words. And now a report out today from the local government association says obesity could bankrupt the NHS and doctors need to be frank and have frank conversations with their patients and routinely weigh them.
So we're going to debate whether we need a tougher approach in a moment. But first, let's just remind ourselves what Edwina had to say yesterday.
Piece of advice that's come out of all of this is that obesity is a serious risk factor. And obesity, if you're going to deal with obesity, then you're going to have to just eat less. And that's very difficult for people. And it's not advice that they want to listen to. I don't hear it being properly talked about, but it's very, very important.
Is it that simple? Is it time for doctors and healthcare professionals to take a more direct approach with overweight patients? Sarah Brocq, Director of Obesity UK, joins us now from Harrogate, and Dr Hilary is with us in the studio. So, Sarah, you know, we know the problems obesity causes. We know we have a problem in this country with people being overweight and putting strain on their bodies. Isn't it time to just put it bluntly?
Well, the straight answer is absolutely not, because what we're not doing by saying being blunt is understanding obesity. So when someone's living with obesity, their body isn't functioning like someone that isn't living with obesity. So it's if we compare it to someone with asthma, for instance. So someone with asthma, their lungs aren't functioning properly, so therefore they need some support and help to help them breathe better. When it comes to obesity, it's the same thing. So it's not just a case of eat less, move more. It's a case of someone's body's not functioning the same way. So what we should be doing is supporting people to actually do things to help them function better, you know, in their bodies that they're living in. So what we're doing is putting blame on people when it's not something that they should be blamed for. But
doing nothing, I mean, surely that's not the answer, is it? We should be doing something to tackle obesity. So what should we be doing? Why shouldn't doctors, you know, weigh their patients as a reminder? Well, because I don't think people living with obesity need reminding that they are a certain weight. I mean, I'm someone that lives with obesity myself, and I went through a phase of weighing myself every day, and all that did was just reinforce to me the negative feelings I feel about myself, of being a failure and you know, not liking myself. So actually what we need to do is support people, because what we don't have right now is support in this country for people and weight management services. 45% of the country pre-COVID had access to weight management services. So what are the other 55% of the country meant to do? So what we need to do is, as GPs and as kind of healthcare professionals, is offer more support to people. So whether that's psychological interventions, therapeutic interventions, surgical interventions, we need access to more of these services, and that's what's not happening currently.
Hilary, if it was just as simple as hearing the message, eat less, do more, move more, wouldn't the obesity problem be solved really quickly?
It would be, but that advice is not helpful. It's not as simple as that. You can eat plenty if you eat the right things. It's not a question of quantity of what you're eating. It's about choices you make, what you can afford. It's about health inequalities and poverty, deprived areas. It's about many, many different things. It's very complex. But Sarah's right in some ways.
So how is the idea of weighing somebody who is already overweight when they come in to see a GP, quite potentially about something else?
Well, you're monitoring...
How could that help?
Because you're monitoring their weight, like you're monitoring their blood pressure or you're monitoring their cholesterol. Unless you measure it, you can't see what progress or not is being made. And I agree with Sarah that people who are overweight or obese need GP support. But unless you address the problem in the first place, you can't motivate them and you can't give them that support. So the conversation has to take place. It has to be honest, it has to be frank, it has to be non-judgmental. And certainly the support services need to be there. But when £65 million is being spent by social services in terms of bariatric equipment, such as reinforced beds, heavy-duty wheelchairs, etc., it's something that needs to be solved because the NHS can't afford it.
Sarah, I mean, you say people are very aware they're overweight, but often, actually, sometimes there have been accusations that the system at the moment supports that. So type 2 diabetics will often be given medicine for that, whereas actually some type 2 diabetics, by losing weight, have got rid of that. You know what I mean? The system's been there to support the problems the obesity causes rather than tackle the obesity.
Yeah, absolutely. But the problem with obesity is it's not just about losing weight. So most people living with obesity will have lost weight over and over again. Again, I'm one of these people. So it's not a case of just lose weight and then life is over, life changes and that's it. It's about a case of you need to lose weight and then sustain that weight loss. And that is where the difficulties come in. Because when you're fighting against a body that physiologically is trying to make you put that weight back on, because that's what happens in people living with obesity, it's not as simple as just kind of like, right, you're eating a certain way, that's it now, you've lost the weight, that, brilliant. You're going to then regain weight. So it's about how do we work on ways to make people just live healthier lives and healthier choices rather than just focusing on a weight, because that's where it all falls down, I think.
I mean, Hilary, that point that Sarah's making about physiology, I assume, Sarah, you're referring to the fact that when you lose weight, your body can then go into a state of trying to put it back on because to your body, oh, my goodness, I'm being starved, is what it's hearing and feeling. That's about breaking the cycle, isn't it, Hilary? Yeah,
it's about breaking the cycle. Of course, you need psychological support as well as changing your metabolism. You need plenty of support, and a lot of that, why do you eat? Is it because you're bored? Are you eating for comfort? Have you been abused in the past? There are all sorts of reasons why people put on weight and then go on a diet and then put it back on again. It has to be sustained and it has to be carried out in the right way. So that support is essential. But look, if I'm a doctor sitting in the surgery and somebody comes in and they've got a skin cancer because of the result of their sunbathing habits, I would be condoning them carrying on with their sunbathing habits if I didn't mention it and say you need to protect yourself. If I come across somebody who's clearly showing signs that they're drinking too much alcohol and subject to liver disease, would I not be at fault in my duty not to address the problem? Of course I would. And the same applies to people who are overweight or obese. We are facing a massive crisis in this country. By 2024, it's thought a third of adults will be obese, not just overweight, but obese. We're seeing type 2 diabetes as a result. Coronary heart disease, we're seeing liver disease, we're seeing psychological problems, we're seeing arthritis. And it's costing the NHS a fortune. We need to take children at school, make sure we monitor whether they're becoming overweight or not, and nip it in the bud before they become morbidly obese, so it's threatening their lives. 30% of cancers are caused by being overweight. Of course, we must address this in the surgery. Be frank, be honest, non-judgmental, give them the support.
Well, it's got lots of people talking on our social media. Mandy, actually on email, what a brilliant idea to offer the service of weighing in at your doctors to cut down on obesity. During the lockdown, so many people have put on excess weight, me included. The problem being our doctors are not seeing patients for any reason. Everything is now over the phone. How can they monitor people over the phone? The no's, though, Sarah on email, I am classed as overweight, but have actually been suffering from an eating disorder for over 10 years. If I regularly went to the doctors and got weighed, I fear my health would have suffered and I'd restrict my food and my bulimia would have worsened. I'm aware that I'm overweight, but constantly hearing it from someone else would not be helpful.